Welcome to the MamasteFit YouTube channel. In this video, I'm going to be breaking down the top questions that we have gotten this year from our followers on Instagram, YouTube, and our online education courses. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I'm going to be answering the top questions that we get on our Instagram, our YouTube, and our education courses. Every Sunday, we do a Q&A on our Instagram page. And these are the questions that we most commonly get. They deal with baby's position. How do I help my baby get into the best position? They deal with pelvic pain. How do I resolve pelvic pain during pregnancy? Or I'm having this discomfort here. How do I fix it? A really common one is, what do I do? My provider wants me to be induced. How do I manage that? We get asked, when can I return to fitness in the postpartum? When can I start working out? What is the best exercise that I can do? And another really common one that we get is dealing with prolapse, diastasis, leaking. How do I deal with all of the things, pelvic floor, core, as I heal in the postpartum? And so I'm going to be answering those questions in this video, and we're going to start with, how do I get my baby into the best position for birth? And so first, it's important to note there is no one best position for our baby. Our baby has to rotate and move through several positions as they navigate through the pelvis. And so trying to force our baby into one specific position is not helpful. However, you may have been told at an appointment that your baby is in this one position and that we want to try to force them to get into another position. Or you may have a little bit of anxiety from a previous labor where your baby was maybe OP or posterior, where their back is to your back. That may have caused some issues during your labor. And so you may be really wanting to get your baby into what you believe to be the best position. And so again, there's no one best position for our baby to be in, and trying to force them into a specific position is really just going to be wasted effort and probably just create more anxiety for you. And so what we can do instead of trying to force our baby into a specific position is to ensure that their path to rotate is clear. And what I mean by this is all of the muscles and tissues and ligaments that are in your baby's path as they begin to rotate into your pelvis when we have strong contractions during labor, they are free of restrictions, they are free of tension. So it's really easy for our baby to make that rotation when we have those strong contractions. And so we want to be thinking about releasing tension in the uterine ligaments, and we can do this with inversions, with belly sifting, like jiggling, pelvic floor releases. And so we want to ensure that that path is first clear for our baby. And then we can think about the surrounding musculature. So your abdominal muscles, your back muscles, the hip flexors, are those free of restrictions? Do you have good mobility in those muscles so that you can kind of change your position to help baby move when we are in labor? And then the last place we want to think about is the pelvis. How well is the pelvis able to move? What is your pelvic mobility like? Can we create space within our pelvis to help our baby rotate? So rather than trying to force our baby into one specific position, we want to ensure that our baby's path to rotate is clear. So we're releasing tension in the uterine ligaments, the surrounding musculature and tissues, and improving pelvic mobility. And I'll link our video down below that has a workout of movements that you can do during pregnancy to help support your baby's position. And we incorporate this within our prenatal fitness programs as well. The next top question that we get is, how do I deal with pelvic pain? And so with pelvic pain, there's usually two variations to it, and you may have one or the other, or you may have a combination of both. The first one is pubic symphysis dysfunction, known as SPD, and this is going to be front pelvic pain. And it may be really centralized, or it may be a little bit towards one side or the other, but usually it's deep within the groin. On the back side of our pelvis, you may be experiencing SI joint pain, which can also be referred to as sciatic pain, or tailbone pain, or just a deep pain within the glute. Both the front and the back pelvic pain tend to be amplified with single leg movements or pivoting movements. So even just walking, standing on one leg to put your pants on, getting out of your car. So just functional daily movements that we need to do can be really debilitating for us during pregnancy. And it can be very common. Unfortunately, you may have been told that there's really no solution to pelvic pain other than giving birth, which is not true. So there's two main causes of pelvic pain. The first is going to be your pelvic position. How is your pelvis positioned onto itself so that those joints can stabilize and kind of compress or puzzle piece together? This can be associated with muscular imbalances, and so one side might be a little bit tighter than the other, which is kind of torquing within the pelvis, making it hard for those joints to kind of compress on themselves. And so the way to resolve this first issue is to figure out what is the imbalance. Typically, the right hip sits more back and the left hip sits more forward. And so we can focus on the the right side, strengthening the glute and the quad to help pull that pelvis half forward. And on the left side, we can focus on strengthening the inner thigh and the hamstring to help pull that pelvis half backwards. And so that'll help pull the pelvis into a more neutral position. We can then focus on releasing muscles as well to make it easier for us to find that pelvic balance. So on the right side, we typically want to focus on releasing the inner thigh musculature, while on the left side, we typically want to focus on releasing more of the glute and pelvic floor musculature. Now, the second thing that could be contributing towards pelvic pain is the coordination across the pelvic joints. How well do the muscles and the tissues kind of compress on those joints to help with force closure? So with this, we're thinking about the myofascial sling. So how well do these different lines of muscles and connective tissue work together to help stabilize that joint? On the front side of the body, we have the anterior oblique sling. This goes from our chest, crosses our abs into our inner thigh, and this is a key player to help stabilize that front pelvic joint. And so really rotational movement to the front side of our body, like a diagonal banded pull down or an upward chop, are going to be really helpful to strengthening this sling. On the back side of our body, we have the posterior oblique sling, which is going to be your lat to your opposite glute. And we can do this with movements where we're rowing in one arm and extending in the other hip. And so a common one in our prenatal fitness program is a step up with banded row or a lunge with banded row. We also have our lateral sling and our deep longitudinal sling, and both of these help with single leg stability. And so all four of these slings are really important to helping with pelvic stability and are why we incorporate so many pelvic stability exercises within our prenatal fitness programs. Pain is not a requirement of pregnancy, even though it may seem like it is because it is so common and you may not have been given any solutions to help resolve it. We have an entire pelvic stability program that goes over different movements that you can do to find pain relief. You can also work with a pelvic floor physical therapist during pregnancy. And then again, our prenatal fitness programs incorporate all these exercises as well. So if you're having pelvic pain, typically to the front, to the back, or maybe even both sides, we want to be focusing on pelvic balance. So we may need to strengthen the muscles on one side versus the other, and then releasing the opposing muscles so that we can find that balance and improve mobility within the pelvis. And then we want to focus on the myofascial slings to help with that force closure on the pelvic joints so the muscles are stabilizing to help keep those joints comfortable. And again, remember, pain is not a requirement of pregnancy. There's so many things that we can do to find pain relief, and we'll link our podcast episode where we break it down even more. The third most common question that we get is, my provider wants me to be induced. What should I do? The first thing is, if your provider is recommending an induction and you feel uneasy on it, I would recommend that you express that to your provider to say, hey, I know that you're recommending an induction. I feel really nervous about it. Can we talk about it even more? And so understand why this is their recommendation, what options that you have, in addition to if you don't want an induction, what additional testing or options do you have to ensure that you and baby are doing well? If you have a prenatal complication, understanding what the recommendations are, and then understanding that you are also an individual. And so just because the generalized recommendation is to induce by this week, it doesn't necessarily mean that you as an individual need to be induced by that week. And so this is a great conversation to have with your provider. Inductions are not bad. They are a great option that is available to us to help support the health of our pregnancy and the health of our babies. However, you should feel confident that this is the best decision for you, and this is why it's important to have that conversation with your provider. I'll link our podcast down below where we talk all about inductions and the different options that are available for inductions, plus reasons why you may be induced, with some questions that you can ask your provider if they are recommending induction so that you can make a decision on whether or not induction is best for you. And so we never want to tell you should do this or you should not do that because, one, I don't know your specific medical situation. I'm also not you, so I don't know what your specific preferences are. And so it's really important that we can have these conversations with our provider so they can help guide us through these different decision points within our birth. The fourth most common question we get is, when can I return to fitness in the postpartum? What can I start doing now to help my pelvic floor to do all these things? So first of all, it's important to note that each of us is an individual. And so our timelines will be a little bit different based on what we were doing during pregnancy, how our birth went, were there any complications during our labor and our delivery, and then what type of support do we have postpartum? If you are exhausted and it's really just you kind of fending for yourself, it might be really hard to get a really structured workout routine. And so when it comes to returning to fitness in the postpartum, we can start doing some gentle stuff pretty early on. So within the first 6 weeks. And this can include like diaphragmatic breathing, some gentle mobility, some short walks, and then also some gentle core exercises. And we have a whole free early postpartum recovery course that you can join if you want more of those specific exercises. But you can absolutely begin to do some really gentle stuff in the early weeks postpartum to begin that reconnection process. However, we are not jumping back to the gym. We are not trying to PR. We are not like trying to shrink our waist and do all those things. We're really just focusing on reconnection at this point. When you're about 4 to 6 weeks postpartum, and this would be kind of like the earliest point that I would say, when your postpartum bleeding has pretty much stopped, this may be a time that you can begin to return to structured exercise. When I say return to structured exercise, these workouts should look very different than the workouts you were doing during pregnancy and pre-pregnancy. So we are going to be in a more rehab-focused mindset as we kind of slowly begin to rebuild over the next several weeks. It's important to note that our tissue healing timeline in the postpartum can last up to a year. And so our tissue integrity is not going to be as strong as it was pre-pregnancy. And it's going to take a very long time for it to kind of rebuild itself after birth. And so we do not want to rush this process. I share more about my own personal postpartum return to fitness journey in our podcast. And we also have our postpartum fitness programs where we kind of walk you through how to move about your return to fitness step by step with daily workouts. And so when can you return to workouts in the postpartum? You can do gentle stuff in the first 4 to 6 weeks, and then no earlier than 4 to 6 weeks can you begin to return to more structured exercise. But these workouts are going to be very rehab focused at first, and we're going to slowly build over several months because, again, our tissue healing timeline can take months postpartum, even up to a year. So we really do not want to rush this process. And now the fifth most common question we get is going to deal with dysfunction in the postpartum. So I have a prolapse, what do I do? I have diastasis, what do I do? I'm peeing myself, I have hernias. And so anything kind of dealing with like the core and within the pelvic floor. And so as we are healing postpartum, this is again why it's really important that we slowly build and reconnect with our core, reintegrate our breathing and our movement. Prolapse is something that can be super scary because most of us don't even know what it is, or you may not even know that you have it. And so I would consider prolapse to be similar to like looser skin postpartum. Our bodies are different after we give birth, but it doesn't necessarily mean that it's less functional. And so if your pelvic organ prolapse does not cause symptoms, then it is not a problematic prolapse. Now, if it is causing symptoms, this would be a good reason to work with a pelvic floor physical therapist. And there's a lot of things that you can do to help manage those symptoms, such as internal pessary, pelvic floor physical therapy, and potentially even surgery. But all of these things are going to help you be more comfortable in the postpartum and to live a high quality of life. But in general, if your prolapse does not cause any symptoms for you, it is probably just a normal part of the postpartum, and it doesn't mean that there's any sort of dysfunction involved with it. So myself in particular, I have a grade 2 cystocele, so my bladder kind of pushes into the vaginal wall, but I don't have any symptoms from it, and it does not impact my function at all. And so I don't really have any issues from it. It's just my body's just a little bit different after having kids. Roxanne, on the other hand, had a prolapse that was more symptomatic, and she worked with pelvic floor physical therapy to find relief, and now she can run and jump and live a really full life. And now when it comes to other types of pelvic floor or postpartum dysfunction, such as hernias, leaking, diastasis, these are all things that can be really beneficial to work with a pelvic floor physical therapist as well, because they can kind of see what type of movement patterns that you have or what type of pelvic floor tension that you may be having that is contributing towards these issues. A lot of these issues that may be lingering postpartum could be related to your general postural habits. So how are we generally standing? Are we kind of shifted a little bit towards one side? Are we a little bit more extended? Are we a little bit more compressed? Those can all impact how pressure is distributed within our abdominal cavity, which can contribute towards pelvic floor or core dysfunctional issues. Then we want to think about our breathing pattern. So how are we moving air through our abdomen? How are we managing pressure within our abdomen that could be increasing or decreasing symptoms that we may be feeling? So if we're doing a lot of belly breathing where we're pushing all of our air into our belly, this could be increasing diastasis or making it worse and harder to heal. And so we want to think more about like a 360 breath while we're breathing. If we're breathing also into our belly, we could be putting more pressure to the front half of our pelvic floor, which could be increasing your leaking symptoms or even hernias. So we want to think about our posture and our positioning, trying to find a more neutral position or increasing our mobility within our spine and within our pelvis because we don't want to be stuck in one position all the time. And then thinking about our breathing pattern. Are we breathing more 360? Are we kind of pushing the air towards one direction, either directly into the belly, directly down into the pelvic floor, or are we kind of integrating that system all together? And so these are things that a pelvic floor physical therapist can work with you to help you reintegrate that system to figure out where there may be some imbalances going on to help decrease the dysfunction and to improve your quality of life. We also break down how to approach fitness in the postpartum in our postpartum fitness programs because we want to give you a step-by-step guide to reintegrate your breathing to your movement, to ensure that we have good mobility in the spine and the pelvis, and to decrease tension within your pelvic floor because these are things that are all going to help you feel better in your body after birth. And so those are the top questions that we get on our Instagram page whenever we do our Sunday Q&A. What is the best position for my baby? What should I do if I have pelvic pain? My provider wants me to be induced. What should I do? When can I return to fitness in the postpartum? And then I'm dealing with this issue postpartum. What do I do? And so there's not just one single answer to solve all of these problems. And I can obviously go in way more depth to answer each of these questions so much more. So I'm going to link down in the notes below the podcast episodes and the YouTube videos that we have that go way more in depth into each of these questions. But know that you are not alone if these are questions that you have. And if you want to ask us your questions, either comment down below or head to our Instagram page, and every Sunday, be sure to drop your question in the Sunday Q&A box. If you want more support throughout your pregnancy, check out our online prenatal fitness programs where we give you a day-by-day workout to do to help you stay strong and pain-free throughout your pregnancy as you prepare for birth. You can bundle our prenatal fitness program with our childbirth education course to save an additional 15% off, and we can also add in our pelvic floor prep course as well. If you're postpartum, you can check out our postpartum fitness programs where we give you a step-by-step guide to return to fitness in the postpartum so that you can feel strong and meet the demands of motherhood. You can use code YouTube10 to get 10% off any of our online offerings. And again, things can be bundled together to save an additional 15% off. So let us know what your questions are down in the comments below.